The leadership of the Integrated Care Board have absolute and total commitment to the quality of care that we want to deliver to patients and people receiving care in the North East and North Cumbria, and we want the expertise that's in the room today and the experience and the commitment and the passion that these people have to help us.
Developing the integrated care system as a learning and improvement system, which essentially means how we work together, how we share best practice, how we address unwarranted variation, but most importantly, how in the North East, North Cumbria we can become the best at getting better for our patients and our citizens.
Bringing leaders, staff from across different organisations together to think about, how we focus on improvement, how we learn from each other. The issues we're facing today are huge as a health system, and I believe we can only really solve them by working together and learning together.
I'm actually a practice manager in general practice, and what we've noticed during COVID is actually health inequalities have increased and poverty has increased, isolation has increased, and actually almost every other person we see in primary care now has got a mental health problem. So I suppose my motivation of being in here is actually to be connecting with other system leaders and having a collaborative approach to working together to identify the needs, to work together to plan and design services that actually meet the patient's needs, but actually the whole system galvanises around that individual, and that general practice is a core component of that. So it's lovely to be here at the start of the journey, really.
I've been working in improvement for over 30 years, and so many of the giants whose shoulders we stand on are actually people from the North East. People doing really exceptional improvement work here 30, 20 years ago. And I think now, the opportunity to come together from right across the system, to learn together, to share, I think is immense.
From a CLIP perspective, it's about building on what we've talked about today. It's about making the connections across all of the patch. For me, one of the take-home messages about how much we need to involve our communities more. We've had some patient representation today, some stories from lived experience, but we really need to be rooting our improvement around the voice of our communities.
Addressing health inequalities, and I think inequalities of outcome and experience has obviously been one of the key things. How we can support staff, and I would say that has to go beyond NHS staff. It's staff who are delivering care and support across the entire area, and really how we can build on the learning of the last 2 years in the pandemic and not regress into the bad behaviour that we maybe had before.
To reconnect with people during COVID, we haven't had the opportunity to get together and share thoughts and ideas, and I think that today's been a fantastic opportunity to do that. Share thoughts, look at what we might do differently, and really harness the energy that's in the room. It feels really there's a good buzz, and we're all committed to doing the best that we can for our patients and public moving forwards.
I think today has really shown that there's loads of energy for improvement, but actually it's how we harness that and learning from what people are doing really well in one patch and how we transfer that across in a meaningful way that doesn't lose the essence of what the improvement was in the first place.
That focus on doing something with what we've talked about. It's all about taking it forward into the next steps.
Putting those things into action, because we've got some of the deepest health inequalities anywhere in the country. And what I've heard this morning is some absolute commitment to shift that dial and change that for our populations, for our staff, for our people.
In future, I'd like to see how we can embrace all sectors. Things like the voluntary and community sector has so much to bring and is often seen as the afterthought or the little partner, and really acknowledging the knowledge and the expertise that we have, and actually the size of some of these VCS organisations, so that we're true partners and can really move together.
I think we're working in very, very different ways now. We're being encouraged to work in very integrated systems now, working with a system approach. And we need to think differently, and we need to understand how to do that effectively, how to work collaboratively as leaders. And this kind of event really gives us an opportunity to break down some barriers.
Improvement is generally all around building relationships, the kind of relationships that trust is at the heart of. We're able to talk about the difficult stuff, talk about what we're not doing well, as well as celebrate the excellence that exists.
We've got the opportunity to make a real difference to the people who need our services, who receive our services, but also how we can support all our colleagues working across our services. So if we can come together, if we can use our combined wisdom, our expertise to do that, we'll be making things better and we'll become the best at getting better.